Hi everyone, my name is Luke Yin,
My name is Evan Brooks.
and today we'll be presenting our systematic review and meta-analysis on topical and combination antibiotic therapy in atopic dermatitis and evaluating both its short-term benefits and long-term consequences. But first, a little bit about us. I am a rising senior at the Illinois Mathematics and Science Academy, and I aspire to become a dermatologist. I'm also a student researcher at Northwestern University, where most of my current work revolves around epidermolysis bullosa, a chronic skin condition. Moreover, I'm a participant in the Harvard Open Bio Student Research Institute this summer, where I conducted this research project.
And a little bit about me. I just graduated from Auburn High School and I'm a rising freshman at Johns Hopkins University studying biophysics. I'm an aspiring surgical oncologist and I worked as a student researcher at Auburn University. So, a little bit about atopic dermatitis, also known as eczema. This is a chronic inflammatory skin condition that leads to itchy and scaly skin. It also causes flares. Atopic dermatitis is caused by the upregulation of the immune system, and to treat these flares, corticosteroids are often prescribed to suppress the immune system. Atopic dermatitis affects nearly 230 million people globally, which is why it's a pressing global health crisis. So, in patients with atopic dermatitis, Staphylococcus aureus colonizations are far more prevalent, as in healthy patients, which is why bacterial colonization leads to worsened bacterial infections. Topical antibiotics are often prescribed to treat these infections, and when antibiotics are prescribed too liberally, this contributes to antibiotic resistance, which is a World Health Organization declared global health threat. It's estimated that in the next 20 years, antibiotic resistance will be the leading cause of death, as opposed to other contributing factors like cancers and strokes. Our objective through this research is to evaluate the short-term effectiveness and long-term risks of topical antibiotics alone or in combination with corticosteroids in treating atopic dermatitis. And our hypothesis is that topical antibiotics will provide short-term relief in atopic dermatitis. However, long-term use will contribute to reduced efficacy and increased antibiotic resistance.
Regarding the study selection process we used to identify the papers for our systematic review, we searched three databases, PubMed, Central, and Web of Science, with the search query listed in the first bullet point. And after setting the filters to clinical trials only, we yielded 466 initial results. Of these results, 444 of them were excluded because they did not fit our inclusion criteria, which is listed below. So some of the inclusion criteria include patients with atopic dermatitis, and then those patients needed to have been treated with topical antibiotics. And we also wanted studies that specifically reported before and after changes in AD severity and results of the AD severity needed to have been reported in quantitative facets such as SCORAD, which is the institutionalized way of reporting the AD severity. So, of the 12 final studies included in our systematic review and meta-analysis, there were 1,200 participants, and nine of those studies focused on combination therapy, which is antibiotics in tandem with corticosteroids, and then three of them focused on antibiotic treatments only. The flow diagram on the right shows how we picked the studies, and this was conducted in accordance with the PRISMA 2020 guidelines. Regarding the results of the combination therapy, we found that most studies did show that there were improvements in the AD severity, namely SCORAD scores were significant and they were decreased in the treatment groups. So just to affirm that the risk ratios were below one in seven of the nine studies. And basically what that means is just that there were significant measures in symptom reduction. And the meta-analysis pooled risk ratio was 0.79. So that's the risk ratio across all of the studies collated together. And ultimately, we found that in three of the studies, topical antibiotics were up to 40% less effective after 4 weeks due to antibiotic resistance.
right? And then in the studies where topical antibiotics only were used, all three studies showed short-term symptom relief. And as Luke stated earlier, the score had improved within the first 1 to 2 weeks of treatment. The risk ratios in 2 out of 3 of these studies were less than 1, showing that the severity of the atopic dermatitis had decreased. No significant adverse effects were reported during short-term use. However, after 4 or more weeks in 2 of these studies, resistance markers and symptom rebound were observed. Our conclusion is that topical antibiotics improve AD symptoms in the short term. However, long-term use may lead to reduced efficacy and contribute to antibiotic resistance. Overall, we saw that combination therapies with corticosteroids and topical antibiotics were more effective than monotherapy, just topical antibiotics. And it's important to note that conservative prescription of topical antibiotics is important to balance patient outcomes as well as global health. When these antibiotics are prescribed too loosely, it leads to antibiotic resistance. So in the future, we should aim to identify non-antibiotic alternatives to control atopic dermatitis flares.
Yeah, so it's really imperative to remember that limiting antibiotic use is crucial in mitigating the effects of antibiotic resistance on our future generations.
These are the references that we used, and these are the included studies in our systematic review.
We'd also like to thank these institutions for helping us conduct the research and provide us opportunities to present it. So that includes the Harvard Undergraduate Open Bio Laboratory, the Center for Student Research and Inquiry at IMSA, the Johns Hopkins Center for Global Health, and the Global Health Leaders Conference at Johns Hopkins University. All right. Thank you so much for listening to our presentation. And if you have any questions, please feel free to reach out to us at the contact information listed below. Thank you.
Thank you.